Good morning po, ma'am. Now po I will be going to demonstrate on how po to assess the breast po and lymphatic system of the patient. So, proceed na po tayo sa procedure. So, first po is to gather po the equipment, which is we have po the centimeter ruler. We have also din po the small pillow, the gloves, the client handouts, and slide for specimen. So, first po is, next naman po is explain na po yung procedure to the patient. So, good morning po sir. Ma'am, I am Leonard Pilansan. I will be your nurse student for today. May I know your name po? About your date of birth? Okay. Okay, so now naman po is um, I will going to assess po your breast and lymphatic system po. This is very necessary po to know if you have abnormalities po ba to this part of your body or kung wala naman po. So, I will going to touch po your breast part and your axillary part po. So, it is okay po ba yun sa inyo? Okay, so next naman po is hand hygiene and provide for the client privacy by closing the curtain. So, next naman po is ask na po the patient to put po a gown. So, assume po that the patient wear na po the gown. Okay? So, first po is sa female breast po muna tayo. So, first po, okay. So, first po, sa procedure is to inspect po the breast. So, inspect po the breast for the size and symmetry po. Okay. So, I will go into use a centimeter ruler. Mhm. Okay, so okay naman po yung size and symmetry naman po yung breast po ni patient. Next naman po is to inspect po for the color and texture. Okay, so yung color. So yung color naman po is okay naman po. And also yung texture is smooth naman po. Next naman po natin is to inspect po for superficial venous pattern. So, okay naman po. Next naman po natin is to inspect po for retraction and dimpling. So, ma'am, can you raise po your hand in the back of your head? Okay. How about po, can you put po your hand to your hips po and press? Okay. So, can you make this po? Okay. Then press po. Okay, so wala naman pong retraction and dimpling po sa breast part po of the patient. Next naman po tayo is bilaterally po. So, inspect po natin the areolas. For notes po natin, the color, the size, shape, and texture. Okay, want to inspect the areolas. Okay, so okay naman po yung color which is pinkish na naman po and also din po the shape and size and texture po is smooth naman po. So okay naman po. Next naman po natin is bilaterally din po is inspect din po natin the nipple of the patient po, the size and direction. Okay. Okay, so yung size naman po is even naman po to the both sides po and also yung direction is okay din po. Next naman po natin is sa palpation naman po tayo. So sa palpation po, first po is to palpate po the breast for the texture and elasticity. I'm going to palpate po the breast. So we have the three types po of breast palpation, which is we have the circular, we have the wedge, and the vertical steer. But now pa, we're going to use the circular palpation. So I will going to use pa of my um, finger pads. Okay, from here, and then from inner to outer. Then sabi naman po, okay, from inner to outer. Okay. So okay naman po yung texture and elasticity po. Next naman po is yung tenderness din po and the and uh, the temperature po. Okay. So, circular motion yun po. So, okay. So, okay din po yung temperature. So, next naman po natin is to inspect na din po for the breast for masses naman po. So, and noting po natin the location, the size, the shape po, and also the mobility, and also din po yung consistency and tenderness. Okay? So, I will go into palpate po. This way. Kaya sa mga po. Okay, so wala naman pong masses sa breast part po ni patient. Next naman po natin is um, palpate na din po natin the nipple. So I will going to use pair of gloves. Okay, so proceed na po tayo to palpation po of nipples. So I will be going to use po my index finger and my thumb po to palpate po the nipples by compressing po. Okay, so I will go okay and observe po for discharge. Okay. So wala naman pong discharge to the nipples po of the patient. So next naman po natin is to palpate na din po for the mastectomy site. But the patient po have no surgical site naman po or scar. So um, um, proceed na po tayo to the male breast naman po tayo. So sa male breast po is the same lang po to the female breast, which is to inspect din po and palpate the breast, the areolas, and also din po the nipples for the swelling, nodules, and ulceration. Okay? The next naman po natin is sa axillary na po tayo. So sa axillary po, first po is to inspect po the axillary for the rashes and infection. So are we going to inspect po? And to the other side po, assume. Okay, so wala naman pong rashes and infection po to this part po of axillary part po of the patient. Next naman po natin is to hold na po the elbow po of the patient and then using po of three finger pads po to the other hand. So palpate po for the axillary lymph nodes. So I'm going to palpate for the axillary lymph nodes and then palpate for high and moving down against the ribs po to feel po the central nodes. And then continue down lang po the posterior axillae to feel po for the posterior nodes. Okay. Okay, so okay naman po siya. Next naman po natin is to um, use na po of by manual palpation po to palpate po or to feel po for the anterior axillary nodes. So I'll be going to press po like this. Okay. Okay, so okay naman po. Next naman po natin is to um, palpate na din po natin the inner aspect po of the upper arm. So I will going to palpate po the inner aspect of the upper arm down po. Okay, while counting the patient. So assume po that I have palpated. Okay. So okay naman po. Okay naman po yung result. So, normal naman po. So, thank you po ma'am for your cooperation and all information lang po that I've gathered is direct to the doctor lang po. So, after po that ma'am is analysis na po of data which is formulating po of nursing diagnosis. Next naman po is formulating of collaborative problems and make necessary referrals po. So, that's all po ma'am for the demonstration for the breast and lymphatic system. So thank you po.